One of the first things I want to point out is we talk about post-mastectomy syndrome is to be careful in your definition of it. Because while it keeps company with a lot of other disorders, it is not those other disorders. I really like to be sort of didactic in how I break up pain syndrome. So on the neuromuscular side, common causes are radiculopathy, pinched nerves in the neck. That can be from tumor, or that can be from degenerative disease. It can be from any number of things. Post-surgical pain, rotator cuff tendonitis, and other diseases of the rotator cuff, epicondylitis, decurvain synovitis, and I can go on and on. So I just want people listening to this to understand that there are a variety of causes of upper extremity pain. Don't just lump them all as post-mastectomy syndrome. Now, what is post-mastectomy syndrome? So in general, it is a neuropathic pain condition reported following mastectomy. The exact mechanism isn't known, but it's probably caused by damage to the nerves. And I'm going to say both the sensory and the motor nerves, and I'll explain that pathophysiology in a minute. How do we take care of these patients? Well, again, number 1, 2, and 3 is physical therapy, right? We also use medications, nerve stabilizers, anti-inflammatories, rarely, but sometimes opioids. This is a place where there isn't a lot of data. I can just say my personal clinical experience is when you have pectoral spasm as a major component, because the pectoralis muscle is denervated, putting some Botox in the pec will sometimes just be an unbelievable fix. But again, it's not for everybody. It's not for the ones who just have the neuropathic pain. It's for the ones who have the spasm of the muscle, and it can help that chest wall squeezing tightness.